Started.
Okay. I don't want you to write anything. You don't need to write anything. I just want you to understand it. Okay? Now we'll be talking about bullet point to do with sexual activity. Okay? It's all 0 to 18. We are not including anybody beyond because we know. You understand? A confidential sexual health service is essential to the welfare of children and young people, which we're talking about. Okay? Concern about confidentiality is the biggest issue for children and young people. Okay? Look at this phrase now that's common. Whenever I say look at this, this is a station. You can disclose relevant information when it is in the public interest. I will tell you now. Comment. Why? If a child is young in an abusive relationship, seriously harmful sexual activity, then you must be sharing relevant information with the appropriate people or agency. That's number one. Did you understand anything from this? So, when to share information about the child, about whoever I'm talking to, when I take history, when am I allowed to share information? Only if there's abuse. That's when we say I will inform. And they even said inform who? Share relevant information with the appropriate people. Not to mother, not to father. You understand? The appropriate. So that's number one rule. Can I share information? Can I share information of a patient regardless the consent from him or her or not? Yes. What is the only situation when I do share relevant information? If there's abusive relationship, okay? If there's a serious harm, sexual harm going on, which what we call it, if she's getting abused, I can tell. Clear? The second paragraph. This paragraph is one station. Is one station. Which station will cover this paragraph I've just mentioned? If a mother is coming, OCP, see OCP, her daughter is having the pill, 15 years old. She knows everything, mental capacity, everything. Can I tell anything to the mother?
No.
Because I don't know yet if there is any harm or abuse or not. The only time I can tell, I can talk, break the confidentiality to the relevant people, not to her auntie, not to her cousin, relevant if there is abuse or harm. Done. Clear. The second paragraph. You should usually share information about sexual activity involving children under 13, involving who are unable to consent. So under 13 years old, unable to consent. Should we share? So under 13 we will share the information, parents and social services. Clear? Anything that's not not. So under 13 years old, do we share? 100%. Yes, under 13. Sorry? Brother, any age. Under 13 I will share under any circumstances. Because it's abuse. Clear? So anybody under 13 years old, should I share the information with parents and social services?
Yes.
Yes. That's one station. It's a whole station about do we tell or not. Even if under 13 with under 13, do I share? 100%. Yes. Okay. The third paragraph. And the third paragraph will add 5-6 words for you that I think I have not mentioned them in my course, and when I read them they are good and they are from the GMC book, so you can add them now when you take in history. whenever you are having young girl or boy, because girls get abused, yeah? And boys as well, yeah? So not only girls, boys as well. You must ask some questions about the kind of relationship to see if there is any drugs involved, alcohol, or if this young person influenced or forced into this sexual activity, bribed with money. Do you understand? Or not?
Yes.
So if a 14 years old is having sex with 30, 29, you can ask. You can ask and you try to see, is there any, is this baby, young, 14 years old, getting influenced by any chance, like bribed with money, under the influence of alcohol or drugs? You understand? Very important. Now, listen to this paragraph. Guys, is it making any sense?
Yes.
Listen to this paragraph comment. So now we know that during a history taking, I should check if a 14 was 25, 30, the type of relation. Maybe there is something dodgy involved. She's getting drugged, yeah? Drugs, getting her drinking alcohol to be drunk and abuse her, yeah? Bribed money, things like this, or being forced. Clear? Okay. There is a paragraph comment, very important. You may not be able, that's very good. They are telling you when you take in history, you will have situations when you are not able to judge. What do I mean, I judge? You are not able to judge, is she getting abused or not?
Suspicious.
You are suspicious. In this case, you have the right to raise a concern. Clear? Again, read this comment now. You may not be able to judge the relationship. You may not be able to know is it abusive or not. You are taking history from a 15 years old girl. You are asking her about her partner, yeah? The relationship, and you're not really sure. Or if she is even not willing to reveal information. So if she is not willing to, or if you are not able to judge, is there any abuse here or not? What should you do? You should carefully balance the benefits and the risks of this young person. The benefits against the risks. Which mean use your, do I see something here that doesn't sound right or not? And if you feel that there is something may sound not right, you can raise a concern, which mean involve social services. Is it clear? So if you have a station, they are telling you. If you have a scenario where you're not sure, or if you're speaking to the patient and she's not giving you any information, use your brain, risk and benefit from the conversation. If you feel that yes, I'm suspecting there might be something here, you have the right to raise a concern. Clear? Guys, I'm trying to relate it to, the paragraph, and it's full of stations here, different situations. Now, very important, they are all important, bullet points. And they will give you the core and what you want. You should usually share information about abusive or seriously harmful sexual activity involving any child or young person, including that which involve. Now I will give you 1, 2, 3, 4 situation where you will involve social services, where you don't need a consent. So now I will be talking about when do you share without consent. When do you tell social services without, and don't I mean without consent, I mean you will tell. Number 1, if this person immature to understand about the consent, which means if she doesn't have mental capacity, if she doesn't understand what's happening, no mental capacity, do you tell or not? Number 1, yes, I will. Number 2, when do I inform social services? If there is a big age difference. If there is what? So if she is lack of consent, if she doesn't have mental capacity, do you inform?
Yes.
What if she is 16 with no mental capacity? Inform. What if she's 17 with no mental capacity? Inform. Guys, are you lost? So they tell you if there is no mental capacity, inform. That's number one case when to inform social services. What is the second situation where I will inform social services? Big age difference, and please, I will explain it now. Just leave it. I will tell you what do I mean by big age difference, yeah? Big age difference. Number three, a young person's having sexual activity with a partner who has a position of trust. What does that mean? Partner with a position of trust. Teacher, GP. And recently, they involved coach. If you are having a swimming coach, yeah? 2 months back, they were discussing it in the parliament that they need to involve this as well. Your coach is a position of trust. So, if your partner, if you are young, and your partner is in a position of trust, do you inform? Yes. I hope you are not lost. Okay, the last situation where you inform social services and you don't need consent. If there is, which I mentioned it before, force into having sex,
Or under the influence of abuse.
bribe with money, alcohol, drugs. Because sometimes people can have sex with a young girl and bribe her with drug. I will give you drug. They give her drug. Or they drug her. Or, you understand, money. Or, so, you can inform. So now, we have added very nice 2-3 questions into these stations. What are the questions that I added? I can ask whenever I have a 14 years old and she's coming and there's sex involved, I can ask. Yeah? Have you been forced into having? Beautiful question. Not many people will ask. Do you agree with me? Another question. Is there any money involved? I'm sorry to, but hi, signpost, huh? I'm sorry some question may sound odd, but please bear with me. It's a part of my consultation. Is there any money involved? Any, do you usually, when you during the sexual activity, like, are you under the influence of alcohol or drugs? And you know your face when you say, I'm sorry, just some question. It shows that you are really, not like, well, I'm sorry to ask these questions, you know? No, I'm sorry, you know? Like, so show that you are sorry and ask these questions. Clear. That's it. This is the first chapter which I told you now, which is giving you bullet point of the rules, and you apply it in your
Own style.
That's it, guys. Your own style. Follow your own style. Don't have, follow the patient and, okay? The second one. The second one is just 1 page. 1 page, the second one. The second one is talking about contraception, abortion, STI. But it's 1 page. And it's 1 paragraph, I think. 1 paragraph. Listen, because that will answer the question that you were asking in the mentor group. Before I read the paragraph, I will tell you. If a 14 years old girl is having, I'm really embarrassed. The baby is sitting in the side. Yeah. If a 14 years old girl is having sex with 25 years old male, yeah? Is it abuse?
Yes.
Abuse. But she's coming to ask for the emergency contraception. She's coming to ask for the emergency contraception. This is very different from Don the iPod. Brother, where did you get it from? Very different, plastic and...
Sterile one.
No, just like, very different. Sterile, احنا village in Egypt, sterile. So, if a 14 years old having sex with someone who is 25, she's getting abused, right? But she's coming to ask for the emergency contraception. Number 1, do you inform? Do you inform social services? Why? Abuse. But number 2, do you give her the pill? Yes. Clear? Fair enough, she's getting abused. We don't want her to be abused and go through abortion. Because if she doesn't have the pill, she'll be pregnant. So, in all cases, you will give the pill, guys, please. Doctor, but you know, we're encouraging hair. That's in Egypt, we're encouraging hair, not here. You understand? Because sometimes people answer, they say, but we're encouraging hair, you know, by giving her the pill, she's gonna go and you will give her the pill. You're not gonna be that harsh that, no, you will give her the pill. Please, guys, yeah? So there is no situation in the exam where you will not. What is the only situation where you will not give the pill?
She's pregnant.
If there's contraindication. If, for example, PE and she was asking for COCB, yes, then. But according to the sexual activity, for you to say, no, I'm not going to give it because she's getting abused, yes, you will inform social services, but it's not guaranteed that she's going to leave and not have sex again. So you give her the pill and you inform social services. Clear? Okay. And that will go for anything. New station. New station here now. If she's asking for abortion. If she's asking for 15 years old girl. How old? 15. Coming. We know that abortion can be with pills. They can give a tablet.
Yeah.
Or an instrument. Yeah? A 15 years old girl. Pregnant. Asking for abortion. It's a new station. And it's not a new station. It's in the paragraph. They've mentioned it. So can it come?
Can.
Can come.
Yes.
And she's coming. I need to, doctor, I'm pregnant. And I need to have abortion. 15 years old girl. Yes, she has mental capacity. Yes, she knows what abortion is. The first day, do you know what abortion is? Yeah, I want to pass the baby. Is that what you want? Yes, doctor, I don't want the baby. May I ask why? Because it will affect my mental health. I have a future. I have education. Yeah? And I cannot afford having. Do you give her abortion?
Yes.
100% yes. Clear. So as long as she has mental capacity and the abortion will affect her psychologically, mentally, physically, she's allowed an abortion.
According to which week, right?
Well, that's not that. When they bring these stations, the guys in the exam,
The ethical part, not the medical.
it's the ethical part. However, if you are asking about the medical part, up to 9 weeks, up to 9 weeks, tablet. Okay? 9 to 15. 9 to 15. There is a method like kind of suction. Over 15. Cartridge. Cleaning. Yeah, they go, procedure, and they just basically do what? Cartridge. They take that. That's a procedure under general anesthesia. Okay? But again, that's not you. You're not gonna give these options, or in other ways, you are not the one who will perform anything. You are the one who will say, oh, yes, definitely, we can help you with that, and then we're gonna refer you to gynecology because she's gonna be, I mean, if it's over 15 weeks, she'll be under general anesthesia. So it's not you. So don't go there. But I told you just, if you are asking about, don't go there, yeah? So let's read the paragraph. You can provide contraceptive, number 1. Abortion, number 2. STI advice, number 3. STI treatment, number 4. So you can provide anything. You see, what did they say? You can provide pills, emergency pills, abortion, STI advice, STI treatment, without parental consent. What do you mean without parental consent?
Not telling the parent.
Without telling the parent. To a young people under 16. F. What's the meaning of F?
No sexual.
F, I will tell you now. 1, 2, 3, 4. So if a young female coming less than 16 asking for contraception or STI advice or STI treatment or abortion, I don't, and she doesn't want me to tell that? I don't tell? Yes, guys, you don't repeat the question again. If she said, please, doctor, don't tell my parent. Don't go for the script. Your parent are your support system at the end of the day. I advise you to tell them. Doctor, please don't tell them. May I ask why? Well, because I'm really worried. Don't worry, they will support you. No, guys. Don't tell my parent. Don't repeat the question again. Definitely you will not tell them without your. And don't even say anything more than this. I don't even say they are your support at the end of the day. No. Think about it? No. Why? No. Do not repeat the question, please, again. Because she's 14. Imagine if you come to me, seriously, you are 15 years old. Imagine, 15 years old from Libya. And you came to me at your GP, okay? And you said to me, doctor, I've had sex and I need the emergency pill. And you are 14 or 15. What do I mean by 14 or 15? Young. Then, doctor, would you tell my parent? Well, you know, they are your support system. Why do you want me to tell them? Well, doctor, they're gonna kill. No, don't worry, they'll be fine. Well, doctor, but please don't tell. Think about it. You think about it, and you know. But I highly advise you that you tell them. What would you think?
You will go and tell them.
She will think that I will tell them. That kind of conversation will. At 14 years old, guys, she might go and commit suicide because she's so scared. You understand? But that's not what I'm saying now. That's what they're saying. Yeah? GMC saying STI, abortion, contraception, emergency contraception. Wallah al-Azim, a whole paragraph about parent. Yes, about parent. And it will be her main concern in PLAB 2 exam. Would you tell my parent? And all of us in one sentence. They are your support system. Would you tell them? I highly advise you to tell them. No, I'm not gonna tell them without your consent, and end of the story, don't even repeat anything. So, they are saying, you will not tell or inform the parent, and you will provide contraceptive, abortion, STI, advice, STI treatment to under 16 without telling the parent if what? What is the number one?
Mental capacity.
If they have mental capacity, if they understand. By mental capacity, I mean, do you know what the bill for? Yeah. It's to prevent the pregnancy. Is that what I want? Yeah, I don't want to be pregnant. Do you know what will happen if we don't give you the bill? Yeah, I'll be pregnant. You know, she's good capacity. So number one, if they understand all the aspects of the advice and they can retain the information. What is the second point where I'm not going to tell the parent if she's under 16? In relation to contraception and the STI, the young person is very likely to have sex with or without such a treatment. Which I've just mentioned to you. I said to you, she is 14. She is getting abused. Yeah? She's getting abused. Whether, yes, you treat her or not, or whether you give her the birth, she will have.
She will do it.
That's what they're saying. Whether, you know, I mean, you're not going to tell the parent anything because, I mean, it's not going to make any difference. You understand? But, point number 3, but, they said, if you don't see from the conversation that the parent will be a cause of any harm, you can then tell her, what do I mean? What, you can tell her or support her to tell her parent. What do I mean by no harm?
You assess her safety in the history.
Yes, you assess her safety. How is the relationship between you and you? They are very supportive. They are very good. How do you get on with them? Yeah, they are very good. They are very nice. Everything is fine at home. She's safe. Then why don't you share this with them in that kind of aspect? Not if she's so terrified that they may harm her. Then you encourage her to go and tell them. So that's what they say. So for you to encourage her to tell her parent, to make sure that she is
Safe.
What do I mean by safe? How's things at home?
Fine.
How do you get on with your parent? Yeah? Are they supportive? Yeah, they are very supportive. They are very caring. Then you can say to her, why don't you tell them? Otherwise,
Don't encourage.
don't. Clear? Guys, is there anything that's not clear? I highlighted everything before the lecture in order to break it down. So, huh? This one I've just said, they are talking about the parent. Don't tell the parent if the child doesn't want. Okay? Don't tell. As long as she understands what's happening. However, you can encourage her to tell her parent if you feel that the environment is safe. Why or how do you know it's safe? By the casual discussion. How's things at home? How's your family? Are they supportive? Are they, you know? How do you get on? Yes, you can. You read Arda? Okay. The second point, it's not really our topic. They are saying if you are a doctor and you are getting, that's not a PLAB thing. If you are a doctor and you are getting a case referred to you that it doesn't agree with what you believe in, you can refer. That's it. That's us doctors, not. You understand? Like if I'm getting a case of abortion, for example, and I'm not really, it's not really what I believe at, yeah, I wouldn't do that. So, what to do? They said don't let your morals or what you believe in or anything affect your judgment and things. Just refer, which we don't really need. Okay? That's it. Now, I have made a small comment and I said to you, remind me later about it. The age difference. Okay, the age difference. In a very simple way, guys, you know, PLAB 2, they never bring the same scenarios. Patients always different presentation, yeah? So, I will give you this and I'm sure, inshallah, you're not gonna go wrong with it, and you will not even forget it. It will clear all your doubts. By the way, PLAB 2, what's common is common. Like, you know what? I'm sure like you are all tired and I'm tired, but what we've just discussed now, if you go to the exam without having 2 stations or 1 station from this, come and tell me we didn't. We sat down for 2 hours, but nothing. It's an exam station. What you know the paragraphs that we've mentioned. And with what I'm going to mention, it's a station. Now, look at this. 13 to 16. 13 to 16. So, if a female is between 13 and 16, and she's having sex, do you inform social services? No, don't say no, say it depends. It depends on what, yeah, brother. She's got mental capacity. Age of the partner. If the partner is the same age group.
Not in harm.
Huh?
Not in harm.
Do you inform? He said it depends further. It depends on what? Huh?
Abusive or not? Under the influence
No.
of something.
13 to 16, if the male and the female same age group, which means 14, 15, 15, 16. You understand? If they are within this group, you don't inform anyone. As long as... Perfect. You see, what's your name? Dr. Isa. قال لك as long as not abusive relationship. As long as she's not forced into sex.
Not influence of
As long as no influence of alcohol or drugs, guys, perfect. Yeah, now you understood what I'm talking about now. Dr. Ahmed, you seem lost. Lost? Okay. 13 to 16. The female is between 13 and 16. If the partner is between 13 and 16, no problem. What? You don't inform anyone. However, in your history, use the point that I've given. Use what I've given. In your history, assess. Have you been forced into sex? I'm sorry, but guys, don't say, have you been forced كده. Plain. I'm sorry, I'd like to ask some question that may sound quite intrusive. Please bear with me. How is the relationship between you and your partner? Is he caring? Is he nice with you? By any chance, does he abuse you physically or verbally, or you understand? How do you get on? That's what I'm talking about. 13 to 16. Same age group, no problem. As long as there is no abuse. By that I mean the history of how do you get along. Guys, are you lost? So 13 to 16. Do you wanna inform anyone? Now, under 13. Look, it's like exactly, you know, like, oh, beautiful diagram. Under 13. Under 13. Always inform. Always inform everybody. Her mom, her cousin, her uncle, no. Inform the parents and social services only. Parents and what if under 13 and the partner under 13? Inform. What if there is no abuse? They happy, beautiful, they, you know? Inform. Inform all the time. Under 13, inform. Between 13 and 16?
Depends.
Good. Looking after her. Nice. No force. No drugs. No, everything is okay. They get on well. It's fine. What if the over 16? What do you mean over 16? 18, 19, 17, 20, 17, 19. What if over 16? Guys, no, it's fine. Over 16 is خلاص guys, this is our group. Guys, this is our group. If they are in this group, they must be عيال مع بعض يعني. They must be same age group. Same age group. Under 13, always inform. Over 16, never inform unless, I'll tell you now. So over 16, and when I mean over 16, I mean both.
Even,
Not just one.
even drugs and alcohol.
لا ما هو برضه abuse. He's saying what if she's forced rape?
Yeah.
You understand? What if she 19 and 19 but she's forced rape?
Yeah.
You understand? So no. So any couples over 16 you don't inform. So 17 17 17 19 17 20 17 22 it's fine.
17, 16.
What if someone from this group was someone from the other group? Here you inform. What do you mean? 15, 20. Are they the same? No. So this age group, two together, okay. Over 16 together, okay. One from under 16, one from over 16. Inform. Clear. Are you lost? Seriously, guys, it's straightforward. Assalamu alaikum. 17 حاج. 17 البارتنر 17 حاج. Thank you very much. Everything is okay? Okay. 15, 19. Abuse, yeah? 15, 19. So, what is the age بقى? Let's get one word. What is the age of sexual consent here? 16. So, my cutoff is 16. Not 18. Not, because some of you think it is. Some of you think it is 16, guys. Anybody is lost? No. It is 18 or 16? 16. So over 16 is okay together. Under 16 till 13 is okay? Anybody between 13 and 16 to anyone over 16 is okay? No. دكتورة مروة تمام؟ قاعدة كده على الحيطة طايرة والله. I feel sorry for you as well, you know, like you. Okay. However, أيوة. However, عادل إمام بس دي رشوة. However, the age of consent, we will just get, it's an exception. I don't want this exception to make you lost. It is an exception. So what is the age of consent? 16. Clear? 16. However, they raised it to 18. They raised it to 18. Yeah, only one condition. If the partner is in a position of trust, we raise it to 18. I'm confused now. Don't be confused. Keep the rules as it is. Less than 13?
Inform.
Between 13 and 16? If they are together in the same group?
No.
One from between 13 to 16, one over 16? Inform. So the age of consent is? Only one condition when the age become 18. If the partner is in a position of trust. What do you mean? If the partner is a GP, if the partner is a teacher, then the age become not 16 anymore, 18. Is anyone started to lose it? That's it. That's the only exception. So, what do you mean, Dr. Mo? I mean, add one question. If she is 17, if she is 17, and her partner is 20, is it okay?
Yes.
Yeah, because they are both.
At the same age.
But I just need to add a question. What does he do for living? How do you know him? How did you meet? That's it. What if 19 female with 25? Do you need to ask about the job? No, خلاص, it's over 18.
Over 18.
Because the age raised to 18 only if there's a position of trust. So if the partner is over 18, they are all okay, both okay. But if she is 17, but you told us 16 is okay. Yeah, 16 is the age. But we raise it to 18. If the partner is in a position of trust, she should be over 18, which means she should be more mature to make decisions because it's her teacher, her doctor, you know. So at this, we raise it to 18. So I will tell you only add one question. All this to add one question. What is the question if she is over 16? What is if she is 17 and he's 25? One question to add. How did you? How do you know him? How did you meet? Doctor is my GP. GP? تعال. Give me his details. Give me his GMC number, you know. You understand me? So only one question to add, which is?
Okay, don't feel about it. What did you meet?
How would you ask about it?
Where did you
How
meet?
do you know him? How did you meet? But you know, with a smile, huh? I can ask you, Arda, how did you meet your girlfriend? How did you meet your girlfriend? But I could say, oh, that's really nice. So how did you meet then? Huh? He's my GP. You understand? So when you ask, you're not asking as you are in court with a smile. Position of trust. Okay? Now, guys, you should know this and go for the exam. You don't really need to know, like, you know. Just know this. And whatever they bring, whichever they bring, it's fine. Deal with it. Clear? Confidentiality, okay? When to tell the parent, consent, when to inform social services. Do you have to tell the parent? No. If she's got mental capacity, no. You only encourage her. But if you feel that the environment is not safe, you don't even encourage. When to inform social services? The age you go up to 18, position of trust. That's it. If you wanna really be, there's something called sexting. There's something called. When I write it down, you'll understand. Guys, when I teach, I like to teach the topic. I don't like to teach you a station, a script. You read it and you go. Topic. That might come in the exam. There is something called. What is this? Sexting, which mean texting naked pictures to someone. Texting, you know, sexting. Sex or text. Sex in a text. Sexting. Is it allowed? Arda's looking at me, said, I do send a brother to my partner, whatever. Everybody, like, it's fine. A partner, it's fine. No, is it allowed?
It depends. It depends.
What do you mean by it depends? It depends on the person. No. Again, there is an age. Age for, is it abuse or not? What do you mean? Yes, you can send. If you are 20 and she's 20. If you are 25, she's 25. Yeah, with her consent, you can. But what is the cut limit that I cannot, even if it's a mutual 18? Again, sexting. What is that? That's texting. You know, pictures or images or videos or messages. If it's a mutual, it's okay. As long as you are both over 18. So the age here is
18.
18. That's it. So sexting. That's it. Finished. Prescription.